Hi, Assalamualaikum. My name is Nur Alia binti Ishamuddin. Moving to my part, the organization information. The National Anti-Drug Agency, or its acronym AADK, formerly known as the National Drug Agency, or ADK, was officially established on February 7, 1996. Its establishment was approved by combining the Anti-Drug Task Force, which is PPAD, and the Treatment and Rehabilitation Division, which is BRPD, as the agency. National Drug ADK under the Ministry of Home Affairs Malaysia, which is KDN. On 17 February 1996, NADA is an organization under the Ministry of Home Affairs, which is KDN. The National Anti-Drug Agency is the secretariat to the National Drug Council, MDK, chaired by YB Minister of Home Affairs, and is responsible for all aspects of the country's anti-drug action. Next, role of AADK. Role of AADK is to ensure that all national efforts to combat the trade of drugs are carried out in a planned, directed, and coordinated manner in order to create a drug-free society. There's a four field of work ADK. Now, one is implement prevention program, which is educating the public about the trade of drugs. The programs such as Pintar, Shield, Smart, Tomorrow Leaders, TEKAD, Mahaba, and AADK Squad. Number 2 is implement treatment and rehabilitation program. AADK improve drug information system and evaluate the effectiveness of national anti-drug program. They are planning and coordinating the implementation of rehabilitation program in institution and communities such as Caring Community House, Clinic CNC One Malaysia, CCSC, which is Caring Community Service Center, CCVC, Caring Community Vocational Center, and CCRC, Caring Community Rehabilitation Center. The point of number 3 is provide secretarial services to the National Drug Council. AADK perform operation to track down and arrest people suspected of being addicted. AADK also management of a supervised person, which is a person ordered to undergo treatment and rehabilitation in the community by a court under Section 61B of the Drug Addict Act 1983. AADK also handling complaints related to drug problem. AADK enhance regional and international cooperation in combating the trade of drugs. National anti-drug agencies are also established at the state and district level. The state AADK director is responsible to the AADK Director General, while the district AADK chief official is responsible to the state AADK director.
Najwa binti Baharum, and I would like to share about the issue of the social problems that required a program called TEKAD, or the Drug-Free Workplace, that been introduced by the AADK Anti-Drugs Agency in 2010. So the program was to prevent any drug abuse among employees in the workplace by giving educations and awareness. Based on the article, there is a statement where the AADK like to assist the police department to combat the police officer addiction. This is because in the Operation Blue Devil, there were 100 policemen were caught, tested positive for drug substance. Drugs are the illicit substance that cause to the hallucinations, coordination impairment, and also severe cases, even the death. Based on the article, the issue was drug abuse within the public or the private sector. Why drug abuse become an issue to the workplace? This is because drug abuse fall into the three groups, which are the depressants, stimulants, and also the hallucinogens. Depressants cause to the someone to become more depressions, and the stimulants cause to the alertness, and the hallucinogens cause to the hallucination, which is someone feel dissociation for oneself. When there is drug abuse, there is also drug addictions. Drug addictions lead to the other crime, such as Inspector General of Police, Mr. Abdul Hamid Badu, said that the 100 policemen that were caught because of drugs also involved into the other crimes, such as bribery, blackmail, and also extortion of foreign workers because they need money to feed their addictions in drugs. As for that, the police officers showed that they are not concerned about their safety, also health, and also they are not concerned the safety for other employees. This is bound to the Section 24 OSHA Occupational Safety Health Acts 1994. Since it a case or issue drug abuse among workers either in the private or public sector, the Department of Occupational Safety and Health have introduced the Code of Practice in preventing drug abuse in the workplace. This is to make sure the workplace in a safe environment and prohibit the employees to get involved into the drugs addiction. To back to the case or the issue, the policemen should not involve in the drug because they need to combat the drug abuse cases among citizens. This show that the policemen was not taking care of themselves, of their safety or health. Also, they are not taking the safety and health to other public servants. This is where it bound to the Section 24. So the drug-free workplace program were bound to the OSHA Occupational Safety Health Acts 1994 are being guided by the OSHA to equip the employees with the skills in manage the drug abuse problems at the workplace. Also to help or treat the policemen that were already involved in the drugs.
The implementation of TEKAD, tempat kerja bebas dadah, or also known as drug-free workplace, is to demonstrate the commitment of the government towards the issue of drug abuse within the public and private sector. It is decided that all the government officials and staff are required to undergo a random urine test when they are required. The statistic by the National Anti-Drugs Agency have shown that the highest age group with the drug abuse is between 18 to 40 years old, which is belongs to the group of youth. It is also a group that is productive at the workplace. The target group for this program are employees and employees in the public or private sector and anti-drug committee at the workplace. The objective for this program are to keep the workplace areas drug-free, and it is also provide a knowledge to the employers and employees on the danger of the drug abuse. By having a drug-free workplace environment, it also can increase the commitment of the employer and employees. This program also provide the supervisor skills in managing drug abuse problems in the workplace to employees and provide effective rehabilitation programs. This program also are set to prevent the drug abuse in the workplace and create a healthy and safe work environment. And lastly, it is also to identify the employees who are at risk of engaging with the drug abuse. The National Anti-Drugs Agency also has provided 8 steps for the management to prevent drug abuse at the workplace. Firstly, commitment and leadership from the management. Second, establish policies and committee for anti-drugs at the workplace. The management can inform the employees that drugs are definitely prohibited at the workplace, and the employees also should know the reason why the policies were implemented and their impact if it were violated. Third, training for the supervisor. Supervisors are responsible towards their employees. So, the supervisor can attend a training such as kemahiran asas counselling so that they know how to persuade and have a discussion with the problematic employees. It is also their work to make sure that their employees fully understand about the drug policy, and they can take an action to their employees if it necessary. Fourth, it is to educate and aware the employees about the impact of the drug abuse. 5, urine test program. 6, refer to receive treatment and rehabilitation. 7, program in communities such as do an anti-drug exhibition or put up a poster and billboard. And lastly, the intervention of the workers. The other employees can cooperate with the to hand over the employees who are involved with drug abuse to their supervisor.
Hai, Assalamualaikum warahmatullahi wabarakatuh. I am Sharifah Nashuhada binti Tuan Muhammad Sukri. So today I would like to present about the work breakdown structure, and I'm going to present about our activity schedule for this ADS 553 subject. This is our assignment progressing of strategic management for public sector. We are having 70 days in order to complete all of our assignment. For the first week, we are going to have a consultation with our lecturer, which will be led by Farah. We are going to consult about the program, public organization, and also the article that we are choosing. We are going to have an explanation the issue that we choose, which is drug abuse at the workplace. And in this week, we are also going to discuss specifically regarding to the article and the issue that we have. And then all of the chosen article and the program that we are choose and the public organization that we are choose, we are going to update in the near future. Okay, for the second week, we are going to discuss more on the organization information, which will be led by Alia. We are going to choose a NADA organization, which is National Anti-Drug Agency. We are more focusing on and discussing more regarding to the NADA, and then all of the information that we get, we are going to update it on Canva apps. By using the Canva app, we can discuss and show each ideas. In week 3, we are going to focusing more on the program information, which is the program that we are choosing is TEKAD program. TEKAD stand for drug free in a workplace. In this week, we are going to search more information on TEKAD's efficiency, and then all of the information that we get about the TEKAD program, we are going to update on Canva apps. For the week 4, we have made an appointment with our lecturer in order to have a consultation about the draft assignment and our progressing of assignment. After we are having a consultation, we are going to make some improvement and the correction if needed. Okay, next, we are going to submit this video draft assignment in week 5. Before we are submitting the video draft assignment, we are going to compile the full video assignment and then make a final check before submit the video, and then after that we are going to submit the video draft assignment in the future. Okay, next, in another week, which is in week 6, we are going to focusing more on case study, which is the case study is by choosing the past year question, which is December 2018. The case study is about the keynote address at the Prosperity for All Summit in 2017 in Pasai City yang berbahagia Datuk Seri Najib Razak, which in this week we are going to distribute all the tasks to each members group. In week 7, we are going to having a meeting by using Google Meet, because we are using the Google Meet in order to discuss more about the case study question and the content of the assignment. We are in order to brainstorm each idea from each member so that everyone is involved and contribute in finish the case study and content of the assignment. Okay, in week 8, we are going to prepare our slide presentation, which is Farah. We're going to lead on this week. We are going to manage a presentation style by using Canva apps, and then we are going to finish the slide presentation with a concise and solid information. we need to submit the case study in week 9. So before we are submitting the case study, we are going to compile all of the case study answer that has been answered by each member, and then we are going to have a final check regarding all the question that we are make. Okay, in a week 10, we are going to focusing more on our article, which is will be lead by Nabiha. We are going to have an additional article to make as a references. We are looking for more additional article regarding to the TEKAD program. We are going to completing the content of the assignment report in this week 10. In week 11, I will be lead in preparing the video presentation by using Canva, which is we are going to present the content of the assignment. Every group members will be record their video presentation, and then we are going to update in a Canva apps. And then we are going to compiling all of the video to become a full video of presentation together with the slide presentation. In week 12, we are going to focusing more on our report assignment. We are going to finish our report assignment in this week. We are going to having a final check on all the content of the assignment, full information, concise information, and then after that we are going to compile the report assignment. We are need to submit our assignment in week 13. We are going to submit the report assignment and also the video. For the last week, we have finished all of our assignment, the case study, the report assignment, and also the video presentation.
So, hi, Assalamualaikum warahmatullahi wabarakatuh. I am Nurul Nabiha binti Muhammad Nuri. So today I am going to focus on the Gantt chart first. So for the Gantt chart, as we can see here, we already plan in detail from week 1 until week 14. So we will follow all the tasks here according to the plan, so that we are going to finish everything on time. So as we can see here, all the Gantt chart is in blue color, which is it is on the right time. Even our network diagram is in red because the time is already limited, which means we cannot procrastinate anything for our task. But still, the Gantt chart and the network diagram is in the right way because we are looking to the WBS that we already planned before. So, yeah, that's all for our Gantt chart. Thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Nabiha binti Muhammad Nuri. So today I am going to present the network diagram and Gantt chart for our group. So basically, as we can see here, we have 14 weeks of network diagram that we already planned, as already mentioned before in WBS, and our leader is Farah. So everything everything that is related to our assignment from week 1 until week 14 will be led by her, and she is going to confirm, to check whether the submission of our assignment will be on time or not. Okay, as I already mentioned before, every members in our team has their own task. Farah is not just a leader. She also She also need to focus on the issue. She will lead the team to choose the issue, and then finally we decide to choose the issue, which is the abusation of drug at the workplace. And the second one is Alia. Alia will be lead for organizational information, which is NADA. We choose NADA as our organization, or AADK. And the third one is Hanim. So Hanim will be focusing on we'll be focusing on program information, which is TEKAD. So we are going to discuss together for the issue, for the organization information, for the program information, but everything has their own leader. And then for network diagram and Gantt chart will be lead by me. And the last one for WBS, Syuhada will be take part for that. We'll be focusing on that. And then after that, after the weeks onwards, we are focusing for case study. We are choosing December 2018 as our case study. And then the next assignment will be focusing until week 10, as we can see in the network diagram. And then week 11 until week 14 we'll be focusing to submit all the assignment, and Farah as the leader will make sure that all the assignment will be submit on time. So that's all for network diagram.